Welcome to this edition of the First Aid Show. When the EMS arrive, they often give IV fluids to a patient. We asked the paramedic what fluids are and why are they being given to the patient.
The most common reason that we would give people fluid tends to be because their blood pressure is low. And if we want to transport somebody or move them and they've got a low blood pressure, there's a chance that they will faint or pass out. So we administer fluids to try and increase that blood pressure to a reasonable level so that we can transport them safely. The fluids, mainly with the ambulance service that I work for, will be sodium chloride. Sometimes within a hospital environment or maybe different trusts, it can be different combinations of fluids, but it's all to help regulate the blood pressure.